This project means a lot to the Trust and indeed the local community. Staff are co-locating in terms of the teams. They're able to drive synergy into what they do. There's a whole research function as well that sits alongside the clinical teams, and everyone is in one place. So it's almost like a one-stop shop for delivering services and also having the research alongside.
I think that one of the key things was to provide a more enhanced level of service. I think the existing building that was on the site had smaller accommodation of services and weren't adequate to the standard modern approach to the mental health services provided.
The new design of the building incorporates 36 interview counselling rooms, 6 treatment rooms. It has a public cafe and community areas. It has collaboration zones. It has group rooms, which are also available to be booked by the public.
This building, it's really bright, it's really airy. For me, the number one thing is it's a really sociable space. The meeting rooms on the ground floor enables us to be able to think much more creatively, because previously we were constrained in our other sites around the fact we had tinchy tiny meeting rooms. Now we can do many more community-based, wider group activities.
We wanted to blur the boundaries between the community hub and sort of the mental health aspects of this building. You can see that in terms of trying to create that welcoming nature into the building, making it more sort of community focused, not create a clinical, sterile mental health environment, but to create something that was warm and welcoming, not just to the people that need the help, but the community at large.
When we got on board with the Trust, they made it quite clear, and it aligned really with Keir's values, that we are one team that needs to work together to get to the end goal. We involved the clinicians, the service users, all the stakeholders to talk about the layout of the building, wayfinding, how we made sure that the building didn't look too busy.
The journey of co-production, very exciting. In particular here, working with the service users has been a joy, and they were fully engaged in the process.
Everybody was really, really complimentary about our engagement, to a point where at the end they were really thrilled with us, and we've had a lot of real positive feedback.
Based on the feedback I'm getting right now, the staff really like this building. They like working in here, and that's a good motivation for the staff.
So we've got amazing new spaces. We've got 5 rooms, which is amazing by comparison to what we had. Fully kitted out with all our physical health equipment. The facilities in terms of kitchens, toilets are nicer. I've got a bike shed, which I quite like as a cyclist. And I think the really big improvement is that we've got lots of teams on one site.
I think service users have also expressed the same, the ones I've met, saying this is a really good facility. They're happy coming in here. And I think with the cafe on the ground floor, that encourages that community feel, not seeing it as a mental health facility, but as a community facility.
From the point of view of service users, it's great for people to be able to come back into a really nice, clean, fresh, modern facility in the heart of Islington, enabling them to access care in a much closer to home way, which is a really big thing for us.
The future of this building is fantastic because it's so adaptable. The building can be used for whatever the community want to use it for, really. Not necessarily what we relate to with mental health, but also are relatable to mental health, because it's about getting people together.
Throughout the process, Keir and the Trust, it's always been about creating a good working relationship, which I think we've only developed further as the project went on.
I mean, working with Ryder Architecture has been a real pleasure as well. Ryder being a specialist in mental health, they really helped us in terms of how we engage with our stakeholders and working that through in detail.
Working with Kensington Islington Trust was a really good experience. I think it's reassuring having an honest, trusting relationship with them, and I think it leads to a fantastic result.
So Ryder Architecture have done a fantastic job, both looking at it from an aesthetical purpose and making sure that it's fit for purpose. The facade looks stunning. The council came around the other week and looked and just complimented on how pretty the building is.
Working with Keir is an amazing experience. We've done previous stuff with Keir before. It's an ongoing relationship with them. We've done previous projects with them in the past. I think we both understand the quality that's required from design and delivery.
Working with Care has been phenomenal, and bringing the expertise to the fore to help resolve all the supply chain challenges and still deliver on time. I have to say full credit to the team.
Working with Camden Islington NHS Trust was really, really fantastic. As I've shared earlier, they wanted to do one team. So from the outset, our values aligned. We wanted to do exactly the same thing and bring everybody together.
The quality of the build in terms of Care building this out is also very good in terms of the standard of finish. And I think that's a real testament to Care, and that will stand the test of time.